Good morning, everyone.
Good morning.
Good morning. Let's try that again. Good morning, everyone.
Good morning.
Thank you, and thank you for joining us this morning. And what an incredible day it is for long-term care in Pennsylvania. I'm Zach Schamberg. I'm the president and CEO of the Pennsylvania Healthcare Association, and I am proud to stand here today on behalf of our members, as well as our advocacy partners who work together to achieve a historic investment in long-term care. And you'll hear from them very shortly. You know, throughout every budget process, this venue, the Capitol Rotunda in Harrisburg, is used by advocacy organizations to call for support, for assistance, and for funding. And that includes PHCA. I stood here a little more than 2 months ago, and I asked our elected leaders, who will care? If nursing homes across Pennsylvania continue to close, who will care for our most vulnerable residents? And if providers are forced to turn away vulnerable senior citizens simply because they don't have enough staff, who will care enough here in Harrisburg to step up and to do something about it? Advocacy organizations use these steps and this venue for support, but it's very rare to be able to return to these steps to declare that your voice, and in this case, the collective voice of providers, frontline caregivers, and residents, has been heard loud and clear. And that's why we're here today. On Friday, the members of Pennsylvania's General Assembly approved a state budget and a spending plan that makes a historic investment for the Commonwealth's nursing homes, personal care homes, and assisted living communities. It is truly an investment that could save senior care in this state. It is a long-term investment in long-term care that means more than $500 million to our sector, including state and federal matches. And it answered a call for help from 3 very distinct groups that are here today: the Pennsylvania Healthcare Association, SEIU Healthcare Pennsylvania, and LeadingAge PA. 3 groups historically with different constituencies, different priorities, and different messages. But the COVID-19 pandemic and the uncertain future of long-term care in Pennsylvania changed all that. And today, I am most proud to stand here, not as the leader of the Pennsylvania Healthcare Association, but as part of a long-term care coalition that joined together to fight for the funding necessary that will empower providers to invest in their staff, to recruit more workers to the front lines, and to meet the demands of today's operating environment. And just like our 3 groups came together, so too did Republicans and Democrats, members of the House and the Senate, and the legislative and executive branches of our state government. We're joined here today by some of our champions, and without their advocacy, we would not be standing here today. I mentioned that we asked, who will care? And I think it's safe to say that today we have our answer. In just a few minutes, you'll hear from Speaker of the House, Brian Cutler, House Appropriations Chairman, Matt Bradford, Matt Yarnell, the president of SEIU Healthcare, and Gary Pisano, the president and CEO of LeadingAge PA. But first, it was just a few months ago that Governor Wolf first brought our organizations and the industry as a whole together. He asked us to find common ground. He tasked us to work together. He told us that he would be a champion for our workers and our residents across the state. And I am proud to tell you that he kept his promise. And I'd like to invite him to the podium now. Governor, thank you.
Thank you very much, Zach. It was really wonderful working with everybody around here to get this done. And you're absolutely right. This is really, really important. So it's an honor for me to be here to celebrate this really new chapter in Pennsylvania's long-term care industry. The direct care workers, some of whom are right behind me, who serve older Pennsylvanians in nursing homes, do hard work each and every day. You folks work tirelessly to ensure that our loved ones, our friends, our family members receive the care they need and that we all know they deserve. But we all know these jobs are hard and demanding, right? Very hard and demanding. But they're also important because they keep our older adults safe, healthy, and happy. Far too often, the hard work of the folks back here, people who run these homes, run these facilities, their work has gone unacknowledged and unrewarded. It's just one small piece of evidence Pennsylvania's nursing home regulations have not been updated for 25 years until today, just a few minutes ago. Those guidelines were simply too old, they were too outdated to support the needs of today's nursing home staff, nursing home residents. And that's why my administration has been working hard to make needed updates. The Department of Health has released 4 packages of proposed regulations for skilled nursing facilities with the goal of providing comprehensive changes to better support residents and staff right now and in the years to come. So now I'm pleased to announce that we will be providing a historic funding increase, which Zach talked about in the budget, to skilled nursing facilities all across the Commonwealth of Pennsylvania to help nursing facilities increase staffing, to meet upcoming regulatory requirements that we've also put into place to provide an even better quality of care for the residents they all serve. This is a major step forward for Pennsylvania's long-term care industry. And I have been proud to work so closely with all of you to make this possible. The budget provides $250 million for long-term care, including $131 million in immediate support for nursing facilities using some of the Pennsylvania's remaining ARPA funding. It also lays out a major rate increase for nursing facilities with a requirement that 70% of the funds to be spent directly on resident care to ensure the taxpayer dollars are spent as intended and to provide ongoing support for facilities and staff in the years to come. This funding will help stabilize the direct care workforce and nursing facilities in Pennsylvania. It will help ensure that our direct care workers have the support they need to keep providing high quality care for the residents of those places. So I want to thank SEIU, I want to thank PHCA, LeadingAge, and everyone gathered here today for their support of this important funding and the forthcoming updates to our regulations. Zach, you gave me a lot of credit for putting this together, but you all did it yourselves. You put this together and made it easy for all of us in this building to make this work. So thank you for doing that. And to all of you who work for you guys, thank you for your hard work, because you work each and every day to take care of our fellow Pennsylvanians. You do so much of this. You have done so much for us, for our communities. Now it's time for us to do something for you. That's what this is. So I'm proud to sign this budget this year because it includes this, and this does this, that, and now I'm going to turn this back to Zach. So thank you very much.
I guess I should have waited to talk about that historic investment until I confirmed the governor actually signed the bill. So that is good to hear. Next, I want to turn it over to the president of SEIU Healthcare PA and someone who's become a good friend and a partner in the halls of the Capitol, Matt Yarnell.
So, how are we doing this morning? Good morning. So I just have to get us going a little bit, which is, what do we want? Quality care. When do we want it? Now. What do we want? Quality care. When do we want it? Now. What do we want? Quality care. When do we want it? Now. All right, we gotta get the energy up here. First, I want to just really appreciate the folks who are up here with us today. I want to appreciate Zach's leadership at PHCA, Gary's leadership at LeadingAge, and Governor Wolf for working with us, convening us, and taking very serious the desperate need for investment in this industry, and also our legislative leaders who, at the end of the day, got it all done with us in partnership. So we'll get there in a minute. I'm Matt Yarnell. I'm president of SEIU Healthcare Pennsylvania. I'm a former caregiver myself. I worked 20 years ago at the bedside in a nursing home in State College, Pennsylvania. And so when the governor talks about the fact that we haven't had regulatory reform in 25 years, he's right. I think the COVID pandemic lay bare all of the challenges that our members have faced, our seniors have faced, that the industry has faced over the last several years. And so I want to highlight a couple of things. This victory is really important, and I want to highlight how we got here. It wasn't very long ago we had a hearing and we heard from Tyshia Frazier, a nursing home member who's done this work for 20 years in Philadelphia. And in the height of COVID, she talked about what it was like losing not just one resident on a shift, but multiple residents. Almost an entire unit of folks that she cared for day in and day out lost their lives. And at the same time, Philadelphia didn't know exactly what to do. So folks were getting mixed messages about whether they should wear their mask or not. They were told that they had to put pillowcases over the heads of residents so that the folks picking up the bodies wouldn't get sick. And I share that story because it's that kind of advocacy, that kind of truth-telling that has put us in a position to get everyone to understand that in Pennsylvania, we have to invest in a care system that puts first and foremost the people who need the care, but also cares for the folks doing the work. And so I just want to say that. We have a lot of work to do. This is a huge step in the right direction. We're also going to be able to do the kinds of things that this industry desperately needs. Lift wages, making these really good living wage jobs where people want to come back to work. We're also going to be able to get to safe staffing levels. We're going to be able to end the days of someone taking care of 20 residents on a day shift. We're going to be able to get to 1 to 10. That is a huge move. It is the right thing to do for Pennsylvanians. It's the right thing to do for the industry leaders. It's the right thing to do for all of us. And we're going to be able to get the kind of training and education supports that folks need to be able to have good lives, see this as a really important career, and do the kind of care that Pennsylvanians deserve. I also want to say, just for a moment, it's going to take more work like this. I think this is what government should do and should be about. We should be in a position where we can get the key stakeholders to come together and figure out a path forward that is beneficial to everyone in the Commonwealth. It really is. I'm really proud of it. It's very hard in today's political discourse where there's so much polarization. But I think the thing that our members, caregivers did day in and day out was gone to work in some of the most challenging conditions and also came out and talk to legislative leaders, talk to the governor's office, talk to their employers, talk to everybody about the need for change. And that's how we got here. So we're going to have to stay the course. This one investment is a huge victory and is a huge step in the right direction, and there's so much more to do to get to the kind of care that Pennsylvanians deserve, where people can choose the setting of their choice to live and make sure that they have good care going forward. Last thing I'll say, this is some of the most dangerous work. It was always dangerous work, but when the pandemic hit, it is one of the most dangerous jobs working in a nursing home. And I just want to point out that there were other industries that were really dangerous, and it took the Industrial Revolution, and it took organizing and workers being able to come together to have a seat at the table to make those good jobs safe jobs. And I think we're on the path to that here in Pennsylvania. So with that, I want to just say one more time, what do we want?
Quality care.
When do we want it?
Now.
What do we want?
Quality care.
When do we want it?
Now.
What do we want?
Quality care.
When do we want it?
Now.
Right on. So with that, I'm actually going to call up the Speaker of the House, Brian Cutler, who obviously had a lot to do with getting this over the finish line. Appreciate your leadership. Next, you're up.
Good morning. Thank everybody for being here and all the organizations and the commitment to the residents and the staff that you all represent. And I want to thank you for remaining committed to this issue and helping achieve this victory for all Pennsylvanians. Chances are we all know somebody or have a family member who's currently at one of these facilities. And I know that over the last 2 years, we've all seen the signs that have really indicated a decrease in the availability of employees. We've seen help wanted, now hiring signs pop up all over the Commonwealth. And you can probably think of an instance in the last day or two where someone somewhere said, "We don't have enough staff, please be patient." And for most of the things we all do, we do understand that small inconvenience. But for anyone living in a nursing home or in a long-term care facility, waiting is not an option. The people in need often are our cherished family members. They're not in a position to be patient. They can't wait for services, and they need our help today and every day. So when the question was asked, who will take care of the most vulnerable, this budget answers it loud and clear. We will, together. And I think that's important. And it's important because this is a journey that started at the very early days of the pandemic. You saw the legislature and the executive branch come together and address the needs for PPE for workers, and we worked through all of those policy issues that came up. And now we're working on continuing that effort going forward, utilizing federal funds to help residents immediately and pay off yesterday's and today's bills, while also addressing Medicaid reimbursement rates and fighting to keep life-saving prescription drugs affordable. These are all policies that were the right thing to do in a very difficult time because of the outside challenges that we were presented with. But these are not issues that come with a party affiliation. They don't split down the political aisle. In fact, as was just previously said, I think work like this does just the opposite. It shows that we all have an interest in taking care of people. It makes sure that we recognize that people need help and that we as policymakers can do our part. That's why we were sent to Harrisburg in the first place, to find solutions to improve people's lives. Thank you for having me. Thank you for letting me be a part of this. But as someone who has family members in the system, I do want to thank you for making this investment, making this possible, because we are taking care of our most treasured resource here in the Commonwealth, and that's our people. Thank you.
Good morning. It's a pleasure being here. Hi, I'm Gary Pisano, President and CEO of LeadingAge PA, and I have the honor and the pleasure and the privilege of representing the interest of more than 360 aging services providers in Pennsylvania. I stand beside hardworking and committed advocates, innovators, and educators in pursuit of excellence, giving hope to Pennsylvania seniors for access to quality care. Today, I thank LeadingAge PA members for raising their collective voices in advocacy and support of the residents they care for each and every day. And on behalf of those members and residents, I thank the governor and legislative leaders for hearing the plea and responding in a big way. The plea for help, for resources to combat the devastating pandemic effects and historical underfunding of a sector that serves the most vulnerable of our residents. The historic investment provided for in this budget represents a path forward. It represents a commitment to aging services and sets us on a path that consistently recognizes the need to invest in these essential services and these committed caregiving professionals on an ongoing basis. This gives us the means to begin building back. We can begin to address in a meaningful way the exacerbated staffing shortage of healthcare workers, the associated effects of having diminished access to care by decertifying nearly 1,000 beds across the state due to lack of staff and funding, and the pause this has put on some specialty services, such as memory care. It's also important to thank our fellow stakeholders in this, SEIU and PHCA, for coming together on what we believe to be appropriate staffing levels made feasible with adequate funding and flexibility that recognizes the immense challenges of the workforce crisis and the operational implications of ensuring access to quality care. We will continue to listen to the needs of our aging residents, to those who care for them, and to continue paving the path forward through advocacy, education, and innovation. Pennsylvanians deserve the best long-term care system in America. Together, we have now taken an important step toward achieving that goal. Again, to our committed legislators and the governor for making this possible, that we could come together and do this work, we thank you for hearing us and responding with strong leadership on behalf of Aging Services. I'm going to turn this over to Matt Bradford, our House Appropriations Chair.
Thank you, Zach, and all the allied organizations that came together today for this. Any thanks, though, would be remiss without mentioning the great work of Governor Wolf and Speaker Cutler for truly putting forward a budget that makes historic investments in so many important areas. We're all proud to talk about the education spending, the public safety spending, and of course, the challenges in mental health. But today, specifically, after 2 long years in a very difficult pandemic and so many folks being in the forefront of providing for one of our most acutely affected communities, those in our nursing homes and our assisted living communities. These dollars, this budget, this opportunity, and the leadership presented by Governor Wolf has truly put Pennsylvania in the forefront of addressing our challenge. The leadership of the governor bringing together labor and management and truly working together to recognize, again, as Speaker Cutler said, these are our family members, these are our most vulnerable populations, and we have a special obligation to answer this call. The work in this budget as it affects these communities, thanks to Zach and frankly our friends in SEIU working together in a truly unique way at a time where we needed it so much, is heartening. It brings out the best in our politics. Again, it is not Democrat, Republican, it is not East, West. It is all of us together looking out for our most vulnerable populations. It's a tremendously heartening experience to be here today. I want to thank you for inviting me, if only for a few minutes, to thank our elected officials, our legislative leaders, our governors, but most importantly, those folks who for the last 2 years we have called our first responders, our heroes, but today we're answering the call for them in a small way. And I just want to lend my voice to those, thanking those workers who've taken care of our most vulnerable populations, our seniors and those in these communities. Thank you so much to them, and thank you to Zach for having me here today. Thank you so much.
I want to say thank you again to Governor Wolf. I want to thank the members of the legislature who are here today. I want to thank the members of the legislature who couldn't be here today. As far as we're concerned, this is just the beginning. It has to be. Thank you again. We'll do questions off to the side. Thanks for joining us this morning. Historic investment for the Commonwealth's nursing homes, personal care homes, and assisted living communities. It is truly a very distinct groups that are here today. The Pennsylvania Healthcare Association, SEIU Healthcare Pennsylvania. Not as the leader of the Pennsylvania Healthcare Association, but as part of a long-term care coalition that joined together to fight for the funding necessary that will empower providers to invest in their staff, came together. So too did Republicans and Democrats, members of the House and the Senate, and some of our champions. And without their advocacy, we would not be standing here today. I mentioned that we asked who will care, but our organizations and the industry as a whole together. He asked us to find common ground. Until today, just a few minutes. Those guidelines are simply too old. They were too outdated to support the needs of today's nursing home staff. Comprehensive changes to better support residents and staff right now and in the years to come. So now I'm pleased to announce that we will be providing a historic funding increase, which Zach talked about, and I have been proud to work so closely with all of you to make this possible. The budget provides $250 million for long-term major rate increase for nursing facilities with a requirement of 70% of the funds to be spent directly on resident care to ensure.
Can we huddle up quick? Down the middle?
Now tell